We're redesigning your health in a lot of unexpected ways today. And if you've ever had a migraine headache, you'd probably do anything to stop the searing pain. Does this story sound familiar?
I've had regular headaches for 30 years. I go to bed with a headache and I wake up with a headache. The migraine pain affects my forehead, my temples, and it goes all the way around my head. There's pounding, there's stabbing. My blood pressure goes up. I have heart palpitations. I also have nausea and vomiting. I go to the emergency room at least once a month. A lot of it has to do with fragrance, cologne. I have chemical sensitivities. I'm allergic to smoke. I had an episode flying back from Florida. Came down with a migraine on the airplane, and when we landed, I was met by the paramedics to take me to the hospital. I have tried acupuncture. I have tried herbs. I've done chiropractic. You name it, I've done it. My primary care physician said, "I'm sorry, but I can't help you anymore." I was speechless. I can't live the rest of my life this way.
Nanette refused to take no for an answer. She found a possible solution to end her headache pain forever. Let's have a look.
Morning, how are you?
Morning.
Ready for this?
A little nervous,
Yep.
happy.
Nanette is on the more severe side for headache pain. 30 flares a month, that's daily, and that's significant. We're going to perform what we'd call a migraine operation. This is currently the last step for patients with migraine headaches. So we're looking to find the greater occipital nerve, which is generally compressed in patients with severe migraine headaches, and that's pretty deep in the neck. So I have a piece of the muscle in my hand right here, and that the nerve is going right around and through, and so we're just going to gently separate this. We can see an obvious compression. The left side was really encased in almost concrete-like tissue, causing a significant degree of compression and chronic injury to that nerve. And now we're moving into above the eyes and in the temples. So we do a zigzag incision in the hairline to minimize the appearance of the scar afterwards. And then we're just going to gently elevate this. We can see here the vein and the nerve, very close to each other. We just divided the nerve. You can see there's only one structure standing there now. So we're going to open her eyelid. We're removing the muscle just piece by piece. It just teases out. You can see a little piece right there. It's a very small muscle, but in patients with migraine, it causes a lot of problems. So we have now decompressed nerves on both sides. Just start to close everything up. She'll be off to recovery room. We're happy how the procedure went. I'm looking forward to Nanette's recovery.
I'd like to welcome Nanette and her plastic surgeon, Dr. Edward Miranda, who you saw perform that procedure.
Thank you so much for being here. Wow, that's a big surgery you went through, Nanette. How are you feeling? It was only 3 months ago, yes?
11 weeks ago.
11 weeks ago.
Yeah, to be exact.
How are you feeling?
I am 100% migraine-free. I mean, it's a miracle.
That's fantastic.
You know, and it's so great seeing this as a plastic surgeon. What you're doing is applying so many techniques that we use in aesthetic surgery, brow lifting surgery, in the scalp, around the eyes, but you have used those techniques to help cure her migraine headaches.
It's a great combination of our technique, minimally invasive techniques that we use for cosmetic surgery in the face, craniofacial surgery, and peripheral nerve surgery. It's like the trifecta of plastic surgery.
It sounds like, Miranda, that this was a tough case. You're taking on the people that have not responded to conventional treatment.
That's really an important point. I think many people have migraine headaches. In fact, I think about 25% of American households have someone with a severe migraine headache. But surgery for migraines is probably best reserved for those people who are in situations like Nanette's, or although Nanette's was a severe situation, where they can't function, they can't take, the medications aren't working, or they're at their limit, where they can't take any more of the triptan medications, or they're going in for narcotic IVs during the, during the week or during a month.
Let's go show folks exactly what you did for Nanette. And again, point is, you just mentioned it, this surgery is not for everyone, but in Nanette's case, things went really well. Walk us through what you did.
Well, for Nanette's surgery, we found that through a diagnostic period, as well as through her history and physical examination, that 3 nerves on in both sides of her face and head and neck were compressed by muscles. In other words, they're pinched. So the sites right here, the corrugator muscles that form the frowns when you frown.
So that is right at the supraorbital nerve.
This are just pinching the supraorbital nerve. And then there's the temporalis muscle right here, in which the zygomaticotemporal nerve pierces. Okay, that's one of the major muscles that cause you to chew. Okay, and then in the back of the neck, the greater occipital nerve, which pierces right through one of the spinal muscles that moves and supports the neck. So in order to treat each of these, we either have to weaken the muscle, which can be temporarily done with Botox, but that only lasts 3 or 4 months in the best cases. Or we can do a minimally invasive surgery to divide the muscles and unpinch the nerves.
So you're basically dividing the muscles to unpinch these 3 nerves that were causing her problems as a permanent solution, as opposed to Botox, which paralyze
again,
the muscle.
we have been using Botox for migraines, but as Dr. Miranda said, it is temporary. So what you're doing is trying to pinpoint where the lesion is, which one of these nerves doesn't work, is there a compression, and based on the Botox findings, if it offers relief, you go in and do a more permanent
and I think if Botox is giving relief, that's a very good sign that the surgery will work. But not every person who has a response to Botox makes them a candidate for surgery.
And I think a really important point you just made is migraine headaches are different for everyone. The triggers are different, the types of headaches. The decompression surgery is not going to work for everyone. It's for extreme cases. And I think that's why it's so important, if you suffer from migraine headaches, to get the proper diagnosis, make sure what you're suffering from, and in cases where you're getting no relief, taking that next step like you did.
Well, I think it's very important if you're having headaches to first go see your primary care doctor. They can start the diagnostic and treatment for you. And if you don't respond to the very basic over-the-counter medications or even some prescription medications, then being seen by a neurologist is the next step. Then we can decide whether surgical treatment for your migraine may be beneficial for you.
Well, we really appreciate you, Dr. Miranda, coming on.
Thank you so much.
So happy you're doing well.
Thank you.
Continued success. And coming up,